Hello, everyone. Welcome to this week's update with our town manager around COVID-19 and other topics. I'm James Milan, and I am joined, of course, by town manager Adam Chapdelaine. Adam, we're going to start, of course, talking, just getting an update on the numbers here in town and any new information and/or messaging you want to give. But let me just preface that by saying, we were hoping, I think, to be in a better place by now already. Perhaps realistically, perhaps not. I don't know. But it's a bit of a sobering report from what I can tell this week. Anyway, I'll let you handle that.
Yeah, I think you've described it fairly. I think we'd all hoped. I know I was thinking about it this morning that I don't know who's to blame for this, but back in November and December, I think we all thought there'd be more vaccine available and a flattening or bending down of the curve by this point in 2021. It's not the case, right? We're still seeing transmission in the community. We're still seeing deaths in the community. And I think my message remains the same from weeks past that while this vaccination rolls out, we need to continue to maintain the precautions that we've had in place for what is now close to a year to reduce the risk of transmission in the community. I know I talked about it last week, and it remains true this week that the variants from various parts of the world are, more and more being shown to be present in Massachusetts. I know there was a report yesterday of a woman living, I think, in northeastern Massachusetts with no history of travel coming up positive for the South African variant. So I've said this a lot of times over the past year, I'm not an epidemiologist, but I think that is a pretty clear sign that the variants are here. They're in some cases more contagious, which only increases the risk of the virus. So we need to continue to ask people to limit their social interactions, to remain masked when in public, and to continue to follow the guidelines that have been in place for a while now. And I think it's important to acknowledge we're all fatigued. A lot of people, I've been hearing a lot of people describe over the past couple of weeks, both personally and professionally, hitting the COVID wall. And I see it, I feel it myself, right? There's levels of anxiety and stress and just fatigue with what we've all been facing. But the reason to keep doing it is still there, and that's to keep people alive and healthy. So I think my message will be remarkably consistent this week, and that is keep up the social distancing, keep wearing the mask, keep being safe until we can get through this together.
And on that, I just have to add one little note of, a really kind of positive, optimistic sign. Positive. In that, yet again, yesterday I was out for a walk in the afternoon on the bike path here in Arlington, and I was struck more than anything else by the fact that people with tremendous distance between themselves and anybody else around have been just are masked, and the number of people, it was 100% of the people that I saw in an hour of walking yesterday who were masked up, and that is an impressive thing at this stage, as you said, of collective COVID fatigue that we are all so deeply mired in.
Agreed.
Let me ask you, though, that we're speaking on Thursday, February 18th here, and today is the first day of the next stage of the rollout of vaccines here in Massachusetts, stage 2, group 2, which includes the largest part of that cohort, people 65 and over, and then people with certain comorbidities and other groups as well. But what I am struck by more than anything else is that I don't think that any of the critical voices from the last stage of the rollout and the way that has kind of unfolded here in Massachusetts, I don't think those critical voices have abated at all. And now we're into a next stage in which the governor's already warning that the phone lines are going to be very, very busy, and people should understand that they may not make an appointment until a month out, et cetera. This all, I don't know, it just feels like it should be going better. But you know more than I do. So what can you tell us?
So I would start by saying here locally, and I know other local officials across the Commonwealth are frustrated, just like a lot of people who are going to be watching this video are frustrated. I can only imagine anybody who's watching who tried to log on this morning to get an appointment is very frustrated, right? Everybody knew a million people were going to try to get an appointment this morning, and the website wasn't ready. It's frustrating, and I think it's important to acknowledge the feelings that we're having. I think what we're seeing is the state administration is putting a high, understandable priority on efficiency of distribution. And because of that, they're investing in these mass vaccination sites. And correspondingly, we learned this week that they're divesting in local distribution. So there will be, as of March 1st, there will be no more first dose clinics in individual municipalities or even in regional collaborations between municipalities that can't achieve 750 shots a day for 5 days a week. So we're frustrated by that, but we understand the economies of scale and the efficiencies that are trying to be achieved by the state administration. I think what we're worried about is whether the balance between efficiency and effectiveness is going to be adequately met. I've been describing this as we're all in a race to reach herd immunity together. And efficiency is key to that, but effectiveness is also key to that. And what I'm worried about is we have I have bucketed our population into 3 segments, and it's not absolute, and this is just me thinking out loud, but I think we have people that want the vaccine and are going to rush to get the vaccine as soon as available. And I think we have people that are likely never going to receive the vaccine for any number of reasons, whether they be medical, religious, or just based on distrust of the system. I think the key group, though, are people that would get the vaccine, but are likely either unable to get to the mass vaccination sites or maybe just unwilling to be inconvenienced. And if we're trying to get to 60 to 70% of the population immunized or vaccinated, my worry is that without a more distributed rollout of the vaccine, that we're not going to get to that key middle. And maybe I'm wrong, and maybe the mass vaccination sites will end up working very well, especially as we get into younger and younger populations. But today, based on what we've seen over the past few weeks, what we've seen this morning, and how well I know we can do it at the local level, not just in Arlington, but in many communities, I am worried that we're overemphasizing at the state level efficiency and underemphasizing effectiveness.
It's a great that's a great point that you make, I would say, about that collision, that tension between the incentive to get vaccinated, which clearly lots and lots of us feel, with the inconvenience factor, and just that the obstacle of needing to get to one of these mass vaccination sites and then get through it, et cetera. So we'll have to see how that plays out. I agree with you that it may be easier as the populations get younger who are getting vaccinated, but it does feel, I got to say, to my perspective, a little bit of a missed opportunity to have a bunch of municipalities like Arlington ready to go, and then hamstring that effort by just prioritizing something else. Anyway, guess we will see what happens. Let's pivot for the last part of our chat today to something a little bit more positive, and that is the second round of financing that has come through and been distributed now, or in the process of being distributed, I guess, to local businesses as part of a business resiliency program. Tell us about that.
So fortunately, through the good work of the Select Board, the Planning and Community Development Department, the Chamber of Commerce, just this past week, we were able to officially award 21 grants to small businesses in Arlington via the second round of community development block grant funding that came through the CARES Act at the federal level. So, there's been a lot of work. We have an economic development recovery task force, and so much of what we talk about, James, focuses on the health aspects, understandably, but we all know there's tremendous economic impacts that have been realized from the virus, and a lot of that's impacting small business. So we thought it would be important to share that we can't do everything. We can't save everybody, but via this funding, we're able to give grants, small grants, to 21 businesses in Arlington that will hopefully continue to bridge them until people can come back and start patronizing the businesses more regularly.
That's great news with which to end an update in which, as we warned at the beginning, it's been a kind of a lot of sobering information to share. We will nonetheless remain hopeful. Appreciate your time as always, Adam. I have been speaking to Town Manager Adam Chapdelaine. This is the Town Manager Update, again, and also the COVID-19 update that we do each week. I'm James Milan. Really pleased to have Adam with us and to have you joining us today. Thanks so much for being here, and we'll see you next time.